We've identified a new asbestos-related disease, and we're figuring out ways to avoid it.
Her story lives on in each and every one of you.
Firefighters that have lost their lives, that have really put everything on the line.
Thank you so much. Back in 1999, I was the chief of staff at the Labor Department's Mine Safety and Health Administration. I remember it was 6 o'clock, 6:30 at night, and we got a phone call, and all the support staff were gone, so I picked up the phone, and there was a reporter on the line. His name was Andrew Schneider, and he said he wanted to speak to my boss, who was the Assistant Secretary of Labor, and he said, I'm here in this town in Montana. It was a W.R. Grace vermiculite mine, and it was laced with asbestos, and there are all these people in the town that are sick, and there's lots of people who had died. And your inspectors used to go to this mine, but they never found any asbestos there. So I want to talk to your boss about that. And so I was like, wow. I had this feeling in my gut that this was something really big. And that town was Libby, Montana. And now we are about 15 years later. And Dr. Aubrey Miller is going to take us up to date on the latest health risk assessment related to Libby, Montana. And then Drs. Flores and Black are going to provide comment on what the latest health risk assessment means, both for the people in Libby, Montana, for that community, and also for generally for public health. So I'll turn it over to Dr. Aubrey Miller.
Thank you. And is this working? Okay, thanks. So faced with Libby, Montana, as Celeste kind of nicely grounded the discussion in terms of what we were kind of faced with. So a newspaper reporter identifies a town that's contaminated with asbestos, and a lot of people are sick, and what do we understand about this? And what are our rules and regulations, and how do we even begin to assess community exposures and to try to understand what's safe? I mean, whether it's workers or communities, the issue is what's safe. We're here about asbestos disease awareness in order to advance prevention and to advance protection. And while there's workplace regulations to protect workers, although insufficient, and that's in the U.S. It's a rate that we accept of about 2 to 3 individuals per 1,000 to get excess cancers in the workforce. Now, in 1986, EPA came up with some guidance about how to protect non-workers, and that guidance was based upon worker studies, and about 14 worker studies from around the world. And that was essentially the guidance, and that we've been going along from 1986 on, using that guidance, and all of a sudden Libby happens. And really there wasn't a town in the United States that all of a sudden you had all sorts of disease. EPA is not used to having towns where people are dying or have disease and all this contamination. And how do we understand this guidance to be useful? Does it apply? Is it safe? And so EPA began what became this health assessment. It really started around 2006. And just to give you a little bit of background, it was using some information because Libby had been studied in the workers, so some of the health assessment was focused on worker studies in Libby, but there was also a group of workers that had been working with vermiculite in Ohio. And they were used to also look at another issue because the town wanted to know, not only is it safe for cancer, and we've been focusing a lot about cancer, but asbestos disease. Asbestos disease is not just cancer. It's lung cancer, it's mesothelioma, it's asbestosis, which is scarring of the lungs, but it's also pleural disease, which is scarring of the outside of the lungs. And people that have that scarring on the outside of the lungs, it can be what they call circumscribed or localized pleural thickening, or it can be diffuse, meaning that it's much wider. And that's a spectrum of disease that we want to prevent all of it. We want to prevent all of it. And the question became, how do we really protect people? And is it just cancer that we should be worried about? And all of our regulations are based on cancer. And they were. And the general assumption is, in the country has been, if you protect for cancer, you're protecting for the other stuff. And there's also been folks saying, from industry and others, that's saying, well, we shouldn't even worry about these other diseases. You know, cancer's the big thing. Don't worry about pleural disease. Is that true? So EPA undertook this effort to begin to evaluate the data, and not only evaluate the data in Libby, but also this Ohio plant where they are working with vermiculite, and it was O.M. Scott, and they were working with vermiculite that was used for people's, for lawn care products and things like that, and fertilizer. And so after many years of putting all the data together and evaluating these studies, the focus was really on trying to say, what are we going to do for Libby? Focusing on Libby. But of course, this has much wider ramifications in many ways. But what are we going to do for Libby, and how do we understand what's safe, and what should we be looking at? So not only were they looking at the cancer, but they were looking at non-cancer. And based on these studies, we're able to look at the dose response, the exposure relationship to disease that was not just cancer. And December 2014, EPA, after long review, as Celeste said, it's been a process of 15 years. They really understarted this process in 2006 of beginning these studies, put out this Libby Asbestos, and it has two parts. One's a risk assessment and one's a toxicology assessment. And the toxicology assessment basically said, lo and behold, the people here exposed to the asbestos in Libby have pleural disease, and that pleural disease is happening at levels lower than when there's exposure than when people get cancer. So it's really important because they said this is the critical endpoint. This is the critical health point that we need to protect against. We're not here just to protect against cancer. We're here to protect against asbestos disease. We're here to protect against asbestos disease, and this health endpoint is the one that we need to look at. And not only do they say that pleural disease was the important endpoint, but they say it's happening at lower levels, and this pleural disease is important. It's not something that we sweep under the rug and say this is not important to people. This is an important health endpoint, and this is where we need to protect against. And so now they're using that and the new levels, which I won't spend time talking about the technical levels, but the new levels are being used for the cleanup in Libby and to ensure that people are protected. And it has incredible ramifications for others around the world.
Great. Thank you. Dr. Black?
Well, the community of Libby would certainly has appreciated Aubrey's efforts, because Aubrey was instrumental in making a lot of this happen and helping us understand the toxicity of the Libby amphibole that we are dealing with in the contamination of the community. And finally getting this value and understanding where we, how we can protect people, we now have the challenge in the community to figure out how to do that, and the EPA has been moving ahead with that, and I think we realize that we've got a target now, and the town is after 15 years, the fatigue from Superfund is incredible, and it's hard on the whole community, hard on the economic aspects, and all the things that interfere with communities. So when there's a question of asbestos contamination, but the community can now, we have the target, we can move forward in cleaning up. We see the light at the end of the tunnel, but one thing with that is, of course, this is a very low value we're talking about, and the likelihood of us being able to remove all of that material is not realistic. We've already spent well over $400 million just cleaning up where we are, and there's probably several $100 more million to be spent in finishing the cleanup in the community over the next few years. But the con to this, of course, is that the community will then, it won't be life as usual once this is done. There'll be things called institutional controls that will be implemented within the community, which means that we'll have to, in certain situations, in certain activities in the community, we'll have to take certain precautions. So it's like it's not quite as clean as you'd like, but yet we do know what we're dealing with. We know what we have to do to avoid increased risk, and so the committee is moving ahead with that, and we'll be developing these institutional controls, which will continue to keep us safe, and then of course we'll have to have ongoing monitoring to make sure there's not recontamination of any of the cleaned up areas of the community. So anyway, I'd like to move this on to...
Dr. Flores?
Yeah.
So it was because of this meeting that I actually became involved with Libby. As a surgeon, my understanding of the problem in Libby was that it was a cancer problem, just like Aubrey was talking about, and that the problem was mesothelioma and lung cancers that were out of proportion to what was being seen in the United States, and that is true. However, the bigger problem that we've seen there are that these patients are dying from a disease of their pleura, an asbestos disease, where they get intractable pain, shortness of breath, that eventually leads to death. And that's the thing that I didn't understand. And because of Linda's ability to bring all of us together, I listened to Brad speak several years ago, and I was like, wait, so what is this? This is not a cancer thing? And it's not a cancer thing. And so I went out there, and now I'm part of the Libby team, and basically what we found is that we've identified a new asbestos-related disease, and we're figuring out ways to avoid it and to try and treat it. Now, this is not just a Libby problem. This product that was made in Libby was shipped throughout the United States on trains, and it was flying all over the place as it was getting to its destination. But it is in houses, in buildings throughout the United States. In New York City, this stuff, Monaco, was in the World Trade Center. So also at Mount Sinai, we're looking at the World Trade Center victims. And there are some victims where you look at their skin, and it's not your typical calcifications that you see with asbestosis. It's this stuff that we're seeing in Libby. And so we're doing more research to try and figure out, is there a connection? And so it's interesting how my attention was turned there for one reason, for a cancer reason, and it turned out to be something else. And then while there, I started to understand all the politics involved with dealing with a big corporation that makes a lot of money and what's going on in the community. And when you go to the community there, you'll find some people are very angry. My whole family suffered from this, and you know, this is horrible. How could the country let this happen? And then you see the other side, where you have people who aren't sick, but who work there, and who are angry at the people who are getting sick because they're like, listen, this provides jobs for us. What are you doing? And so it's interesting how you see the human condition affect people from two different areas. And now, why is that important? Because we are starting to see throughout the country naturally occurring asbestos. There is a big controversy in Nevada where they found naturally occurring asbestos in the dust, and initially the group there wanted to report it, and the Nevada Department of Health wasn't too crazy about it, and there were a lot of other interests in there trying to either brush it all over or bring it out to the forefront. Now this study was published in one of our journals, Journal of Thoracic Oncology, which describes the greater amount of mesothelioma and lung cancer that are being seen in that part of the country. Also in North Dakota, they're finding an asbestos-like material called erionite that's in the gravel pile, and this is a substance that was also seen in Turkey and Cappadocia. So there's a lot of studies on these various asbestiform fibers that can cause disease. So I think Libby is not only interesting because it's describing a new disease, but when you look at the whole process there that was required to clean it up and to help improve care, that's going to need to happen in multiple areas in the United States. And that's where you need groups like this to come together with people like Aubrey who can actually make things happen out there.
Aubrey, would you speak for a minute about how Libby, the Amphibole at Libby really helped advance the knowledge about what we would traditionally would think of the 6 asbestos fibers?
So, thank you, Celeste. And, Libby forced us to start looking more closely about identifying asbestos. What do we really know about asbestos, about these fibers? And as Raj was just saying a second ago, about aragonite, about all these kinds of fibers, and how do we measure them? And when we were using workplace methods for the environment, not suitable, and also the understanding about what is it and how much are we exposed to and what kind of disease should we be looking at, because what's acceptable. And no disease is acceptable, but we need to push down those levels. And as Raj was just saying, it's in the environment, it's in our products, it's in homes and vermiculite insulation in millions of homes. So we had to begin to think about what are we really talking about here. And it's also about, if we're going to ban something, if we're banning asbestos, what are we talking about? What should we be identifying, and how low should we push our methods to get rid of it? So in Libby, we were, as I think as Celeste mentioned, we were getting soils and looking at the methods and looking in the soil, we didn't see anything. But then if we measured it in the air, when people were disturbing it, we would get high exposures. Our methods weren't good enough. The methods we were using in Libby weren't adequate to not only identify it, and the same thing happens in products. So we need to understand that marry public health and science to say we are banning it, and we're banning it based on science. We're identifying what it is and at levels that are really pushing toward what's safe. And that's the incredibly important thing. It's in our environment. A ban alone is not going to do it, but how do we protect? We look for it, we find it, and we take public health actions to prevent people from being exposed.